Hello, this is your University of Minnesota Care Team. This is a discharge education video for patients recovering from vaginoplasty. This video will guide you through the important steps and information you need for a smooth recovery. You can find this information in your handbook that you were given before your surgery as well. Let's get started. After your surgery, you may return to your regular home diet. It is important to stay hydrated and eat a balanced diet to support your healing process. Following vaginoplasty, it's essential to protect your surgical sites and allow your body to heal. Here are your activity guidelines. For the first 4 weeks, take small shuffle steps to prevent wide leg movements. Keep your knees close together and take stairs one at a time. Avoid strenuous exercise, lifting, pushing, or pulling more than 10 pounds for 4 to 6 weeks. Be mindful to avoid straining your abdominal area. Avoid activities that put direct pressure on your vagina, like biking, motorcycling, or prolonged sitting. When sitting, use a cushion or donut and shift your weight frequently to avoid pressure on the surgical site. Avoid straining during bowel movements. Do not drive until you can press the brake pedal quickly and fully without pain, and never drive while taking prescribed pain medications. To manage postoperative pain effectively, follow this medication schedule unless otherwise directed by your healthcare provider. Take Tylenol 1,000 mg every 6 hours. Take ibuprofen 600 mg every 6 hours, unless you have a medical reason to not take ibuprofen. If you stagger the doses, for example, taking ibuprofen at 12 p.m. and Tylenol at 3 p.m., you are able to take a medication every 3 hours for good pain control. In addition, you may be prescribed a muscle spasm medication like Robaxin or methocarbamol, which can be taken with Tylenol and ibuprofen. For breakthrough pain, use the prescribed narcotic pain medication, typically oxycodone. Use it sparingly and try to stop as soon as possible. Never exceed 4,000 mg of Tylenol in 24 hours to avoid liver damage. Never exceed 2,400 mg of ibuprofen in 24 hours to avoid kidney damage. You should dispose of unused prescribed pain medication safely or store it in a locked cabinet if needed. Your surgery and pain medications can lead to constipation. To prevent and treat it, you should take pericolase twice daily. Other options include prune juice, Miralax, fiber supplements, or Dulcolax. If you haven't had a bowel movement in 3 days, you can start taking milk of magnesia twice daily until you see results. If the constipation persists, you can always call your care team. Here are guidelines for restarting your medications. If you were taking spironolactone before your surgery, you can stop taking this immediately. You may restart your hormone therapy once you're discharged from the hospital. Schedule an appointment with your hormone prescriber within 1 to 3 months to check on your hormone levels. If you take low-dose aspirin, you can resume this immediately. You should restart any other blood thinners as directed in your discharge instructions. To care for your incisions, you may shower and let warm soapy water run over the incisions starting 48 hours after surgery. Try to avoid scrubbing your incisions. Do not soak in baths, pools, or hot tubs until your surgeon clears you, typically after 8 weeks. Your incisions are closed with dissolvable sutures and may be covered with skin glue. This skin glue will flake off in 1 to 2 weeks. You should leave your incisions uncovered when possible, but you can use gauze as needed to protect your clothing. The sites where your surgical drains were removed will heal within a couple of days. You can keep them covered with daily dressing changes. Once healed, leave the sites uncovered. If you had a full-depth vaginoplasty, please see our separate video on vaginal dilation. Avoid any other vaginal activity until instructed by your care team. Contact your surgeon's office or seek medical attention if you have chills or a fever over 101 degrees Fahrenheit, you're experiencing constipation despite using multiple bowel medications, you notice an increase in bloody drainage or drainage that looks like pus, you're taking your pain medications as directed but still experiencing severe pain, you have difficulty urinating, or if you have any other questions or concerns. Thank you for watching. We hope this video has answered your questions and helped you prepare for a smooth recovery. If you have any other concerns, please don't hesitate to reach out to our clinic. Take care and best wishes for your healing journey.